Gastroscopy, also known as an upper endoscopy, is a minimally invasive diagnostic procedure that plays a pivotal role in the evaluation of various gastrointestinal or GI disorders. Through the use of a flexible tube equipped with a camera and light, gastroscopy allows healthcare providers to visualize and assess the inner lining of the esophagus, stomach, and duodenum, offering valuable insights into a myriad of digestive issues. From unexplained abdominal pain to gastrointestinal bleeding, gastroscopy serves as a cornerstone in the diagnosis and management of gastrointestinal conditions. Gastroscopy can be done to diagnose a number of medical conditions related to the upper gastrointestinal tract. Let's have a look at some of them. 1. Diagnose digestive system conditions. Gastroscopy is a crucial tool in diagnosing various conditions that affect the digestive system. For instance, it can help identify gastroesophageal reflux disease or GERD, a chronic condition where stomach acid frequently flows back into the esophagus, causing irritation. It can also detect ulcers, which are sores that develop on the lining of the stomach, upper small intestine or esophagus, and gastritis, and inflammation or irritation of the stomach lining. 2. Investigate symptoms. Gastroscopy is often used to investigate certain symptoms that suggest problems in the upper gastrointestinal tract. These symptoms include persistent upper abdominal pain, nausea, vomiting, or difficulty swallowing. By directly visualizing the esophagus, stomach, and duodenum, doctors can identify the cause of these symptoms. 3. Check for inflammation or ulcers. Inflammation or ulcers in the stomach lining can cause discomfort and lead to more serious conditions if left untreated. A gastroscopy allows doctors to check for these issues directly, providing a clear image of the stomach lining and enabling them to spot any signs of inflammation or ulcers. 4. Detect cancer. Early detection of cancer significantly increases the chances of successful treatment. Gastroscopy can be used to detect stomach or esophageal cancer at an early stage. During the procedure, doctors can take tissue samples for biopsy, which can confirm the presence of cancer cells. 5. Control bleeding. Upper gastrointestinal bleeding can be life-threatening. A gastroscopy can be used to locate the source of the bleeding. Once the source is found, doctors can use special tools passed through the endoscope to stop the bleeding, such as by cauterizing the bleeding vessel or injecting medications. 6. Remove foreign objects. If a foreign object is accidentally swallowed and becomes stuck in the upper GI tract, a gastroscopy can be used to remove it. This avoids the need for more invasive procedures or surgery. 7. Perform a biopsy. A biopsy involves taking small samples of tissue for further testing. During a gastroscopy, doctors can perform a biopsy to check for conditions like cancer or celiac disease. The biopsy samples are then sent to a lab for analysis. 8. Check for celiac disease. Celiac disease is an autoimmune disorder where the ingestion of gluten leads to damage in the small intestine. If celiac disease is suspected, a gastroscopy may be performed. During the procedure, samples of small intestine tissue can be taken to confirm the diagnosis. 9. Monitor progress of previously diagnosed conditions. If you've been diagnosed with conditions like Barrett's esophagus, which is a complication of GERD, a gastroscopy can be used to monitor your progress and check for any changes in your condition. 10. Confirm or rule out presence of H. pylori bacteria. Helicobacter pylori is a type of bacteria that can infect the stomach and is a common cause of peptic ulcers. A biopsy taken during a gastroscopy can be used to test for these bacteria, helping to guide treatment decisions. The gastroscopy procedure is as follows. Prior to undergoing gastroscopy, patients are typically advised to fast for a specified period to ensure the stomach is empty, facilitating optimal visualization during the procedure. Before the test, the operator will explain to you what is going to happen and ask you to sign a consent form. You may be given a sedative to help you relax one. This is usually given by an injection into a vein in the back of your hand. The operator may numb the back of your throat by spraying on some local anesthetic or give you an anesthetic lozenge to suck. You will be positioned on your left side. The doctor will then insert the gastroscope into your mouth and slowly guide it down the esophagus and into the stomach. The gastroscope is a flexible tube with a light and camera at the end, which allows the doctor to visually evaluate the lining of the esophagus, stomach, and duodenum. During the procedure, the doctor examines the lining of the esophagus, duodenum, and upper part of the small intestine for abnormalities. The procedure is well tolerated, pain-free, and does not affect your breathing. You may experience mild bloating or belching as air is inflated to distend the stomach. The endoscope also has a side channel down which various instruments can pass. These can be manipulated by the operator. For example, the operator may take a small sample, biopsy, from the inside lining of the stomach by using a thin, grabbing instrument which is passed down a side channel. It can also be used to perform treatments, such as removing polyps or cauterizing bleeding areas. The examination takes about 10 minutes to complete. Please note that the arrangements and the way tests are performed may vary between different hospitals and areas. Always follow the instructions given by your doctor or local hospital. Throughout the procedure, the healthcare team closely monitors vital signs and adjusts sedation levels as needed to ensure patients' safety and comfort. Once the examination is complete, the endoscope is carefully withdrawn, and the patient is observed in a recovery area until the effects of sedation have subsided. Following gastroscopy, patients are typically advised to refrain from eating or drinking until the effects of sedation wear off to prevent the risk of aspiration. Mild throat discomfort and bloating may occur temporarily but generally resolve within a few hours. Patients are usually provided with post-procedural instructions and any pertinent findings or recommendations discussed during a follow-up appointment. Gastroscopy is a valuable diagnostic tool that offers a comprehensive assessment of the upper gastrointestinal tract, enabling healthcare providers to diagnose and manage a wide range of GI conditions effectively. By undergoing gastroscopy, patients can gain invaluable insights into their digestive health and embark on the path to optimal wellness.